Yeah, so actually for any vascular lasers, if you treat the patients with telangiectasia, it can regrow because this is normal. Normally when we age or we get sun damage, we can get telangiectasias over time. Definitely, if you treat them already and then you did not really prevent sun damage for more, you will get a new telangiectasia. It's not recurrent, but it's just like the new telangiectasia coming in. For examples, in the patient with rosacea, what I'm doing is I treat them a series of treatment for at least 5 to 6 sessions, and then if it's disappear, I ask the patient to come for maintenance, maybe every 6 months or every year, just for 1 session, or wait till the telangiectasia come back full blown and then retreat them a series of sessions. So I think you can do it the other way around. From my experience, I wish we had that magic lasers, but actually no. Most of the time, exactly 80% you need a few treatment, 2 to 3 treatment sessions, but it depends on how deep, how big the vessels, and also how good your skill and parameter that you set as well. There is a lot of good machines out there, but if you want a peak radiofrequency, I think Thermage is now the best in terms of the temperatures provide to the skin. So the higher the temperature, the skin contraction can go. Secondly, the depth of the penetrations. So it's monopolar, so it's go deep to the whole layer of the collagen. Last but not least, since the new AccuWrap technology, you can get the bulk heating simultaneously at the same time effectively, so the contraction will be maximum. If you have CPT already, which is a good machine, don't get me wrong, I had CPT for almost 10 years before I upgraded it to FLX, but of course I had a reputation of having the best available system. For me, after using FLX and compared to CPT, what I find is I get faster result, and you can treat a lot more older patients. Normally, you may get patients who age more than 70 something years old who did not want to get surgery. I think Thermage FLX can still work on this kind of patient if you treat them well. As I mentioned earlier, I think when we age, our skin is really, fall apart every layer. And some of the machine, you can just treat only a few layers, not 5 at once. And unfortunately, there is no machine that can treat every layer at once. When comparing between Thermage and Althera, so Thermage, you treat the whole layer of the collagen, but Althera, you treat deeper at the SMAS level. Since Althera has different transducers, you can target the layer, but which means you need to use a lot of transducer as well. So for me, I believe in treating everything, so I combine Thermage and Althera together. So my protocol is here. It depends on what patients concern more. If the patient wants some tightening, Thermage will be the first line. But if they want the lifting, which is the FDA approved of Althera, I'll take Althera first. In the patients who is younger, like younger than 50 years old, they need 2 years time treatment, and then I'll do alternate once a year. In the patient who is older than 50 years old, they may need something once a year. So I'll do it 6 months alternately between Thermage and Althera. And with this way, you can treat the whole layer of the skin at once. And what I find is the combination of the treatment provides synergistic effects when comparing to pick either of it. So that is my answer. So normal lasers, like if it's ablative one, you can get the higher, ablative has higher chance of having PIH when comparing to non-ablative. So for me, I advise the patients to avoid sun exposure afterwards. But of course, choosing the good candidate is the key for doctor, and choosing the good machine and good parameter will be prevent the incident of PIH. Last but not least, sometimes what I do is I prescribe bleaching if I predict that the patient will get PIH. So I'll just give them some topicals just in case before even PIH occur, to just prevent it, and ask the patient to apply it for a month after laser. Ice pick scar is the most difficult one. I think the best is punch excision. So which means you use a small punch biopsy to punch it off and then stitch it back. But of course, it's treated with some of the scar, like suture scar, which you may need to treat it afterward anyway. But with any fractional or even fractional RF, it will be very difficult. Ice pick need combination and need a lot of sessions.